welcome back. For many battling obesity, diet and exercise alone are not always effective. Here to talk about some of the surgical options are Dr. John DeBarros and Rebecca from the Weight Loss Institute of Arizona, along with their patient, Charlotte Peters. And we'll get to you in just a second, Charlotte. But Dr. DeBarros, I want to talk about the procedure that you use that helps people who have tried the weight loss, the exercise, it's just not enough.
Well, we use what's called a laparoscopic gastric band. Lap band has been around since 1991, and it is a procedure where we put a small band, a small device around the upper portion of the stomach, and that is connected to tubing. Tubing is connected to a port. Everything is placed underneath the skin on the left-hand side, okay, and the port there. In the office, we put a small, tiny needle in this port in here after we put a little Novocaine on the skin. And we inject some salt water or saline into the band, and it fills up the balloon in this tube inside the band here. And so once it fills it up, it will give you satiation. So when you eat, food goes into the top part of your stomach and kind of slows things as you're going through. Okay?
Gotcha, and so you feel full.
And so you feel full when you eat. So basically, the calorie intake goes way down dramatically. Okay.
Who's the perfect person for this procedure?
So essentially, the NIH criteria, National Institutes of Health, basically states that anybody with a body mass index greater than 35 or about 100 pounds overweight would benefit from this.
Okay.
However, more recent studies have just come out and have been out there for about a couple of years now that patients who have a body mass index of 30 or greater with significant medical problems or about 50 pounds overweight would also benefit from weight loss and weight loss surgery and weight loss reduction.
Okay. And Rebecca, you are a nurse that works there, and what have you seen with your patients? What changes have you witnessed?
Well, when they first come in, we are talking about the things that they can't do and the things that they wish they could do, like play soccer with their son or have a baby. And then 6, 9, a year later, usually we call them and say, "Hi, we haven't seen you for a while. How are you doing? You know, please come in for a checkup." They said, "Oh, I'm doing fine. I just hiked the Grand Canyon in and out in one day." And another lady last week said she did the P.F. Chang's marathon. And this is after 80 pounds of weight loss.
Wow, dramatic changes.
Yeah, absolutely. And one of my favorites is this lady came in after a year, and of course now she's pregnant, first-time mom, and she's, of course, thrilled.
Oh, that's great. See, they can really make a big difference losing that weight. Now, Charlotte, you are a patient. We, I think, have some before shots of you. You're like, oh, here they come. Wow, significant difference. How much weight did you lose from that picture there?
About 115 pounds.
Wow. And when you lose 115 pounds, what hands down is the biggest change in your life when you lose that kind of weight?
I'm able to breathe.
Wow.
I'm able to walk. I can hike. I can jog. My medications are way down. Cholesterol went down. Blood pressure went down. I feel good. I haven't felt this good in years.
Yeah, that's amazing. How did you find the Weight Loss Institute? What made you go to them?
It was an advertisement I saw in a magazine. I was afraid of the gastric bypass. It's pretty radical. And I thought, I can do this. I can do this. And I contacted them and they said, yes, you can. Yes, you can.
And how long ago did you have the procedure?
I had it in February, about like 14 months ago, 15 months ago.
Wow. And I mean, your friends, your family, they must just, you're a different person.
If I haven't seen anybody, even in like 6, 7 months and a year, it's just, they don't even know who I am.
That is amazing.
They recognize the voice, but not ever get anything.
I mean, she said the biggest difference, she could breathe.
Yeah.
I mean, you're talking about just you're not, most people don't even realize until they lose the weight how, I guess, ill they really were.
It's very significant. The biggest issues are the medical problems that can be reversed: diabetes, hypertension, high cholesterol, all these medical problems. So that when you look at somebody that's overweight, that's what I think about when I see a patient that's overweight, not how they look on the outside or aesthetically, but more what's going on with their bodies. How do they feel? Do they get up every morning feeling terrible and feeling like there's no way out, or is there a solution for patients who have tried multiple diet and exercise programs and really don't have an answer?
Wow. Well, Charlotte is a great example of somebody who has dramatically made a difference in your life, and it's good to hear that all these wonderful things have now happened to you because of the procedure. Thank you for sharing that. Thank you, Rebecca. Thank you, Dr. DeBarros. Really good information. And if you're one of those folks watching right now that want to be like Charlotte, you can find the Weight Loss Institute of Arizona at WLIA. WLIAZ.com.